Everyone, good morning. For our quarterly meeting, close out the end of the year, I'd like to thank everybody for joining. This meeting is probably going to be pretty short, which is good. I'm sure for a lot of you guys, hopefully coming back off of holidays and getting stuff done and getting prepared for the end of the year and Christmas, etc. So we'll push through this pretty quickly, I'm sure. But a few good things to share today. So we're going to go ahead and get started. Just our monthly plug for EDAP. If you're not EDAP certified and you're looking to increase your pediatric preparedness, please do so by contacting the good old folks at RAMSC. All right, we'll start with our hospitals. We'll start with Anderson Hospital. Eric, I think you came off mute for a second maybe and went back on. Anyone from Anderson? Okay, hearing none. Alton?
Rachel's here from the EMS side.
Gotcha, Rachel. Thank you. Don't see Aaron. I know I'm going to see him tomorrow. Okay. What about Boyd? Nancy's not on today. Okay. Move over into Carlinville Area Hospital. I know Eric didn't answer first time, but I'll check for Staunton. How about Fayette? I see Tina's lovely picture in the back, so I'm gonna presume that she's here. Okay, gotcha. All right, Gateway.
Danielle's on, and I think Rick will be joining shortly.
Thanks, Danielle.
Yeah, I'm here as well.
Gotcha,
Okay.
Rick. Appreciate it. Thank you. HSHS Holy Family.
Cindy's here for Holy Family.
Cindy, thank you. St. E's.
Brad's here for St. E's and also St. Joseph's Highland.
Gotcha. Thank you, Brad. Anyone from Breeze?
Stacy's here from Breeze.
Casey, thank you very much. Jersey.
Yeah, this is Nick from Jersey.
All right, and from Memorial Hospital Belleville, you got myself, Mike Gilbert, and Lee is on. Eric is not in today. He'll return tomorrow. We're covering for both Belleville and Shiloh. How about Memorial Chester? No Georgia today. Okay. Aaron, I see you've joined.
Yeah, Alton. I'm on.
Gotcha. You may be on two things because I'm hearing a little bit of feedback. So I'm going to mute you real quick, see if you can get that sorted. Thank you. OSF St. Anthony's.
Gary's here.
Gotcha, Gary. Thank you. Redbud. See Tara today. Yeah, how about Sparta?
This is Dale from Sparta.
Gotcha, Dale. Thank you. Touche. Anyone? All right, I'll move over to our health departments. Bond County.
This is Wendy. I'm here.
Thank you, Wendy. Calhoun. Clinton County. Eastside Health District. Fayette. Greene County. Jersey.
Heidi Carter's here for Jersey.
Thank you, Heidi. Macoupton County. Madison.
Jacob's here for Madison County.
Gotcha, Jacob. Thank you. Monroe. Randolph County.
Randolph County present here. This is Deborah.
Oh, gotcha, Deborah. Thank you very much. And St. Clair.
Good morning. This is Kara. I'm here.
Thank you, Kara. over to our community partners and the state. We'll start with Greg, our RMSC.
I'm here, Phil.
Gotcha. And I think I saw Beth on today. Beth, are you here for the ERC?
Yes, I'm here.
Gotcha. Thank you. Any of our BJC partners?
Hey, Phil, good morning. It's Sean.
Good morning, Sean. Thank you very much for BJC. Appreciate it. Any of our EMA partners on?
Keith is here from Jersey E EMA.
Thank you, Keith. Any other EMA folks? Okay. MedStar.
John Nowak's with you.
Gotcha, John. Thank you very much. Anyone from Abbott today?
Hi, Phil. It's Leslie. I was able to join today. Thank you.
Thank you so much, Leslie. Appreciate it. SLU. Is Tim on day? Scott Air Force Base? Nope. And anyone from STARS today? And Eric, I see you joined Brandmeier for Anderson and Staunton.
Thank you.
Gotcha.
And
No
Nancy
worries.
Womever here from Boyd.
Awesome, Nancy. Thank you very much. Glad you could join us. And I see Chuck Kelly from Memorial has joined as well. Any folks that I did not call that want to get recorded, make sure for attendance.
Phil, did you get Monroe
Hey.
County?
Uh-oh, I heard two folks.
Monroe County.
Monroe County, okay, gotcha.
Phil, this is Derek from Macoupin County Public Health Department.
Yes, sir, gotcha, Derek. Thank you.
This is Kendra from Fayette County Health Department.
Hey, Kendra. Hopefully you got my email the other day.
Sam. I messaged Lee, but I'm the 2169 phone number on.
Okay, who was that?
It's Sam from EMA.
Oh, hey, Sam. Good morning. Anyone else, if you're there and you're able to put it in the chat, please go ahead and put it in the chat and we'll get you. We're going to go ahead and get started. Well, happy December, everyone. Got a kind of short agenda for today. We'll go through our standard folks and just a few announcements in preparation getting ready for the beginning of the year. So we'll start with Greg at IDPH.
Morning, everyone. I don't have a lot either. I'll let Beth handle any of the infections that are spreading across our state. But I did want to talk just a second regarding the hospitals. They have been on peak census on and off different hospitals over the last couple of weeks. When I've checked with the hospitals, it does seem to be respiratory illness that may be driving that, though not in every case. But influenza A appears to be the culprit on a lot of these. Today, we had one hospital that was on peak census. We had 30 ED boarders. So just kind of wanted to let everybody know that if you aren't experiencing that, a number of our hospitals are. So be aware when you see some of those notices coming across about peak census in that. The other thing that is happening, I know a lot of you people have, a lot of you have worked with Dan Lee, either with EM Resource or data or bed numbers, that kind of thing. Dan is retiring at the end of the month. So if you normally reached out to him after the end of the month, until I know who will be replacing him, you can go ahead and send any questions to me, and I will attempt to find answers to that. And then speaking of bed numbers, there does seem to have been improvement with some of the hospitals out there, but there are still a couple of hospitals who are registering, 7% compliance, 20% compliance. So please review those bed numbers. If it's your hospital, please reach out to those that are reporting your bed numbers and make sure you go over the process that we've already shared on these previous meetings. And Phil, that's all I have unless somebody has any questions.
I see Tina has a question. Go ahead, Tina.
Can you hear me or not?
Yep, we can hear you. Go ahead.
So about the bed reporting, I know something came out starting, was it November? I can't remember the date, that we're supposed to go in and update our bed numbers at 10 and 6 in the evening. And so I'm a little bit confused because I've been doing that. I'm trying to get those done every 8 hours as that directive it did come out. So are we still supposed to be doing that? And then today it looks like EM Resource trying to update that at 10, having problems even logging in. So that's kind of my questions.
The answer to your second question is, yeah, I had difficulty. It's very, very slow for some reason today. I don't know what is going on with it, but I'm sure it's just a glitch and they will get that fixed. I have to tell you, I don't remember something coming out saying not to update that way. Phil, did you get any siren notices to say just to go back to once a day?
Not that I can recall, and I'm actually looking now while you were talking about it, but
yeah, I can double check. I do know that peak census and even bypass at some of the northern hospitals have been happening. Of course, the bypass with permission from IDPH because of all of this respiratory illness. And still, while I believe RSV has gotten better statewide, I still think there's concerns with pediatric beds. So I did not get a message that it's ended, but I can double check on that for you, Tina.
Greg, this is Julie Smith. I checked with Ashley yesterday and she said to keep doing it until noted otherwise.
Okay, great. Perfect. There's your answer, Tina.
Thank you.
Hey, real quick, John Nowak. As far as EM Resource, there was a notice that was put out, it was probably 4 o'clock this morning, that they were having trouble with one of their servers and that they would have to be pushing everything to another server in Colorado or something. I'm trying to remember this off the top of my head, but that is probably the reason for the log or the extended time of getting in. Just throwing that out there.
Thank you. That must be why too, when you go on now, it's wanting you to sign, that terms and policy thing also.
I have some odd requests.
all right, thank you. Okay, hold on one sec. Let me mute that one caller. Okay, go ahead.
Are we able to see our own compliance with reporting? I know that I think we were doing the check-ins every day, but weren't hitting the right buttons or something. So we changed our process, and I just want to make for sure we're one of the ones that have improved here at Gateway.
Phil, did you send the latest out to this group? I don't have the distribution list for this group, but
I thought I sent the last one, but I can go check the but there isn't a way to readily see it. If that's what you're asking within EM Resource, you kind of have to do some reports yourself, and it's a little bit painful if you ask me. Primarily because if by chance, normally if you're looking day to day, and I think we talked about this during the training, that it will show you the last time EM Resource was updated, just looking at it. But if you go into the further details, you may have one out of, they may have not have updated OR beds or what have you that day, or left peds at 0 from the day prior, which means, just because we don't have peds beds, everybody knows that sometimes that gets skipped over. And if that's not updated as well, that can cause it being down. So it's a little hard to do it. Just generally looking at it, you can't get like a percentage. I'm not exactly sure how Dan and crew, how they pulled those numbers. But I can, if I didn't send out the last one, I can definitely send out whatever the last one was. I'm just looking at my emails now. I can send that out after this meeting, so you can at least have it, but
That's great. Thank you.
no worries. Any other questions for Greg?
Phil, this is Tina, and I looked at the email and Dan sent out our regional, that whole 11-page thing for all the regions on December 1st.
Got it. Yep. Any other questions for Greg? Okay. Thanks, Greg. We'll move over to Beth. Beth?
Good morning, everyone. Can you hear me okay?
Yes, ma'am.
All right. So as Greg talked about, the numbers are climbing. It's not unexpected. Tomorrow will be exactly 2 weeks since Thanksgiving, where a lot of families get together, and the disease can spread. I know you are all aware of what's going on with the hospitals and the healthcare systems. The city of St. Louis issued a health advisory on Tuesday to provide current status of winter respiratory viruses in the city of St. Louis. And I can send this if you guys did not get it. Generally, health advisory is just to let everybody know what's going on. These are not issued routinely, so we like to pay attention to them. And as Greg mentioned too, from St. Louis City Health Department, 97% of reported cases have been influenza A. So like I said, I can send this out. You guys can read all the details. Just to let you know, IDPH is planning to hire a infectious prevention person, one for each region in the state. This is something new that we have not done before. I'm not exactly sure what their capacity is, if they're going to primarily work with long-term care. I think that's the plan. We are having an open house today, IDPH, at our new regional office in Fairview Heights. If any of you want to stop by today, you're more than welcome. I think it runs from 11 to 2. And I will let Heidi and Jacob talk about what's going on in their jurisdictions with personnel. And other than that, I hope everyone has a great holiday and everyone gets some time off to spend with family and friends. And Merry Christmas. Thanks, Phil.
Thanks, Beth. And did you guys want to go now? Go ahead. Beth, did you say you had some folks with some updates? Other updates?
When you go through the county health department, I was giving them a leadway to
okay, well, we'll
make some announcements. So yeah, I'll let them do that when you go through the health departments.
yeah, we'll do that now. We'll do it now. And well, before they go, is there food at the thingamabob today? At the office? Because I'll stop by if it's right by my house, so I'll stop by if that's the thing.
I do not know. I've been back in my office. I haven't been up there to the front yet, but everything's all, they've got platters sitting out. So maybe cookies, I don't know.
Well, sounds like I know what I'm doing for lunch. Okay. So any other updates from the health departments? Once, twice, thrice? Okay. Any of our stars team members jump on late by chance? Once, twice, thrice. I'll give Lee an opportunity. I mean, he attends a lot of our stars meetings. I haven't attended the last recent one. Anything that you could think of, Lee, off the top of your head?
Not especially. We've had some ongoing discussions just in general regarding like the trailer caches again has come back up, and just the general sharing of information across the coalitions and some development on training, but that's still a ways out.
Okay. Thanks, Lee. Yeah, as far as those trailers, expect to hear from us probably by February on where we think we need to be going with the trailers that we do have. And I know a few of our hospitals around the region have STARS trailers parked there. But yeah, there's the move afoot to try to get all that realigned. So stay tuned.
Hey, Phil, just to
Yep.
throw that in there.
Go ahead,
The
John.
EMS committee with STARS is also trying to get updated information, updated location on all the STARS equipment as far as EMS trailers. So that's an ongoing process that we're hoping to have done by the end of January.
Yep, indeed. Thank you, John. Over to Mike. Any remote updates, Mike?
We're starting to move more into a lot more planning for this coming year. Starting Friday, we'll start attending the planning sessions for the Scott Air Show to start planning the response and support to Scott Air Force Base for the 3 days of the air show. We are and then working on a couple other events that we're going to be working with state police, with the youth camp. We're doing ongoing planning with that. So just getting ready for next year's events and how we can support the agencies around us.
Thanks, Mike. If there's ever an event where we could probably use some support, it's always the air show. A lot of people like to show up for those to participate, or not just to participate in the planning, but to go out and have fun and all that type of stuff, which is great. But that is it's kind of a, when we work with the marathon each year, but that's more of a marathon kind of event that we host each year, outside of, I guess, the big raceway stuff that we've done recently, that the team has been out on recently. So if you ever want to support a great event that for the community, the Scott Air Force Base Air Show is one of those ones. So if you have any folks that are looking to dip their toes in volunteerism here in the community, please reach out, and I'm sure we can find a spot for them to support. Manpower is always needed. Yep.
So I forgot to mention that last week a couple of us did go support the 932nd MDS, which is the reserves field hospital unit out at Scott. We went out and supported them in some training, and we were building a really good relationship with those guys on being able to share information on how they set up field hospitals, how they do site selections, all of that. Their command staff's really working with us and sharing information back and forth.
Yeah, that sounds like a great opportunity there. And Mike, do you want to say anything about the austere? I know we got the stuff coming up for the austere course.
Yeah, so we are starting our introduction to austere or prolonged field care course for REMERT. We have a core of our REMERT staff, and then we've also opened it to Scott Air Force Base. So the 932nd MDS is sending 2 of their medics to it, and they are also Washington University EMS Fellowship is sending 2 physicians to the class to support us during the class. So it will be a week-long course where we are being taught to take care of patients with limited resources and limited means of transport, where we may have to actually sit on a patient for an extended period before we can get a transport out from wherever we're at, with limited resources, limited ability to reach back to resources outside of the area we're in.
A lot of times you'll see this type of training, obviously in, I hate to say in a wartime environment, but where you have wildland fires and places where areas get cut off for, as Mike said, extended periods of time. For us, the scenario that, we're probably most likely having to deal with something like that is extreme flooding, like the, 1 in 1,000-year flood, what we have here, where we got folks in areas for several days where they can't get out, and potentially earthquakes. So, two of our, highest things on our HVAs out here. So we're still continuing to put effort and resources and time into making sure that we have field medics, and again, some of those EMS fellows in the know, some for things that, while we may not encounter often, that they get at least some background in it, because we do this class now and we do maybe a follow-up. We have some follow-up that goes along with it, but 10 years from now they can rely on some of that experience, and not just as day-to-day. So there's another good opportunity for REMERT and the coalition to expand our disaster care. So thanks, Mike. All right. We'll move over just to grant status. Kind of the good thing is it was approved late November. So the GMO will be in contact with those of you who had project requests. And I can just say this is a record for IDPH. I've been here, I started in 2015, March 1st, 2015, and this is the fastest that any grant that we've been a part of has been approved, fully executed. So I gave my thanks to Teresa Tolar at the National Healthcare Preparedness Coalition Conference last week, because once I got that notice, I was just ecstatic, to be quite honest. And this will be the first year that we're not managing, my office or our grants management office is managing 2 grants concurrently. So I don't know what to do. Run around, do a cartwheel. I know I'm gonna run over to Greg's place and eat some food off of one of them platters, apparently for lunch. I don't know how else I can celebrate today, but I'm extremely excited. So thanks to the folks at IDPH, and thank each one of you who've put in those project requests, and you get your information back. Hopefully this year we're able to spend money in a much more timely fashion because we have more time, but this gives you opportunity to go ahead and spend. And what it will also give us the opportunity is this will give us more leeway, or lead time, I should say, with regard to changing or looking at any revisions to the budget so we can reapply them later. In most instances, we could not open this up to full project requests late. Let's say we've got $70,000 remaining and it's April, it's the middle of April, and we know that we can switch some stuff around and spend it on another priority that we may have here across the coalition. Most of the times we can't open that up to the entire coalition because it's so late, and getting all the paperwork and doing all that just makes it too time consuming. Now we may have that opportunity. So I encourage those who work with our grants management office to get that paperwork back. Go ahead and spend your money and cry broke after it. Say, oh, I'm done spending. I don't have anything, but I'd like to do this as another project. We may be able to extend a second round of project requests out to your organization, or maybe someone who didn't submit a project request and subsequently came across an option during, oh, we could do this, or we'd like to do that, and get that approved. So any questions with regard to the grant? And then one last note, this will be the last year, and again, finally confirming again with Teresa last week, is that this will be the last year that we will use eGrams. So Amplifund is on the docket to start for the 2024 grant. So that'll, I think, take us to BP5. I don't know if we're BP3, BP4, but it'll be the software of choice to manage the grant. All right, medical response and surge exercise. Many of you, we've talked about this in the past. We've done the coalition surge, or the CST, coalition surge training, or whatever that we've done in the past. That converted a year ago to the Mercy or Medical Response and Surge exercise. It took its place. It's very similar but different at the same time. It is an annual requirement that each of us must participate in. So we are targeting the 1st of March. That is a Wednesday at 10 o'clock. So it'll be one of our, so the January, February, March, that's our quarterly meeting time. And our time starts there. So that's a day that we normally have a lot of participation and everything. So this year I'm trying to target that, unless we want to move it to another date. But I think that's a good time, since we normally schedule 2 hours for our quarterly meetings. This can give us an opportunity to have a lot of the same folks that are participating on that day to participate in this exercise. Unlike the previous CST exercise, that was a low to no notice exercise. This isn't a low to no notice exercise, so I can give you the date now. We can get a few things accomplished prior to the day to make this exercise go over a little more seamless. And then we can communicate all of, conduct this, and that includes that duration I have there is 4 hours. That's just an approximation. It more than likely will, it'll probably be a little shorter, but that does include the after actions reporting time and the hot wash time and everything. So that's soup to nuts, beginning to end, the duration exercise. The CST is designed to test a surge of 20% of the coalition's licensed beds. So for us, that's a roughly 370 patients. It is a functional level exercise. And again, like I said, it is mandatory. We will conduct it virtually through Teams, but we will probably need some support to go out to a few of the locations. It does target hospitals primarily, but that does not mean that the health department, local EMAs, and EMS cannot participate. We will need some support to go to some of the locations. The majority of the work to act as facilitators. The majority of the work will be done digitally, electronically. So that shouldn't, stop anyone, so you don't have a facilitator at your organization, but because the majority of it is done virtually. So, but we would like to have a few folks. So if you'd like to volunteer to be a facilitator and, maybe go out to Gateway or go out to the good folks at Boyd and hang out and just in case we lose communication or to relay specific information, we could use you because my team gets spread pretty thin really, 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 really quickly. That AAR will be done it has to be done within 60 days, but it will be done probably shorter than that. And there's a full form that we fill out that we have to upload the results of that form into what's called a coalition assessment tool. You guys heard us talk about the CAT before, so ASPR can pull that information. I will say, the folks that have participated in the past, I'll just throw a few names out there. Obviously, the memorials have participated in the past, but Gateway has participated in the past, and we've hosted there as well. OSF St. Anthony's has participated, and they've hosted us as well. We probably won't need a host hospital at all, just to cut down on travel and everything. We may not need a host hospital. So again, my team will probably work here, but it will work exactly the same. And I hate to put a few folks on the spot, but Gary, if you're still on, what was your perspective and how'd your team receive the CST when we held it at your location at OSF?
Yeah, I think our team, our leadership and our management team, they really thought it was a good exercise. I think that we learned a lot. I think we're constantly going through different change in leadership and change of our administration and senior team. So I think it was very educational. We learned a lot. I think it was something that I'm glad that we did and look forward to participating in the future.
Thanks, Gary. So, and this one will be, the last one did a lot with EMS and ensuring that we can find or, we can identify, transport from an evacuation side of it for the hospital, especially the one that we're hosting it at. This one won't be the same. While we will involve EMS, it won't be necessarily an evacuation exercise. It will be a more traditional surge based around a centralized event. Also, the previous exercise, we were contained to using those hospitals within the region. It was kind of a strictly fence line, and which was understandable. This one, however, we can reach across the river or even go further out. And we did that quasi in during the CSTs, but it was designed to be fenced within the borders of the region. This one is more open to, again, going west to our St. Louis partners and as far east as we need to go if need be. So you can imagine 370 patients, that being the focused event. Now, the thing about this as well is that if we were to flip this on its head and we did 20% of all the St. Louis hospitals in their region, and I don't know what date, Sean or Lee, I don't know what date that they've discussed, the team in the St. Louis Coalition have talked about conducting theirs, but just imagine they have more beds than we do, and they would have to spread this way, just like we would expect in a surge. So it's a partnership. We want to test a lot of those lines of communication, but we're also going to, which will be a little bit different than the CST, we're actually going to test your triage capability slightly as well. So there will be more decision-based scenarios for the hospitals that are participating. So you can actually loop in your EDs, you can loop in folks that are not, your pharmacists, your intensivists, or whatever, that are maybe not or participating routinely. A lot of times we get hospital, some administrators, and the preparedness coordinator, but this will give opportunities for some of your clinical staff and direct care staff to participate as well, because you have to make actual decisions during this one. So last year we did not conduct this exercise because we took credit for the December, almost a year ago to the day. What was it, 12/10 last year when the Amazon warehouse tornado hit. We utilized that real world incident to fulfill the exercise requirement. So we didn't have to participate like we did in the previous 3 years. So I'll pause right here. I see Gary has his hand up for any questions regarding the Mercy exercise. Gary, go ahead.
Yeah, so for the exercise, that you said it's going to be on Teams. Is there going to be an invite? Because I'd like to send it out to my whole leadership. That way we can all get involved.
Yep. So there will be a full invite. So what I ask you to do is that, as you'll see on the screen now, and then the slide presentation I put out there, if you go ahead and register on that link that's there, once you register there, that it will, matter of fact, I'm pulling it up now and I'll throw it in the chat. Once you register there, I did put a section in there to add additional points of contact. I added additional 5. So if yourself or whomever is the organization POC, and then I've added 5 other slots for emails that you want to do there. And then once we get there, we'll be in contact. If we need to add further folks, but yeah, we will put it out there. We'll actually put out a event calendar. So we'll actually pretty much sign up there. That'll be the next thing. But I want to know who you want. If you're going to participate, if you fill out that form today, that'll let us know that you are going to participate. So I threw that in the chat as well. Yep, there we go. I see Brad threw it in there as well. So hopefully that answered your question, Gary.
Yeah, great. Thank you. We're looking forward to it.
Perfect. Anyone else, any questions regarding the Mercy exercise? No. We also, I don't have a slide on this, but we also, it's been a couple months now. We sent out the requests for the medical surge numbers. It's a spreadsheet that we normally fill out each year. I think we've got back what we've gotten back. I'm gonna send it out one more time and just extend this out to the end of the year. But I'll send it back out to the hospitals. Just need to have you fill out that form. If, when you receive it, if it's no change from what you had last time, just reply back and indicate that there's no change and we can move forward. But I do know, let's say like in Gateway's concern, we've lost some pediatric surge capability based on, or psych bed capability, doing the closing down of a few beds. And if some of those things have changed, we want to make sure we capture that as well. So I'm going to send that out after this meeting. So please take a look at it. And reply back with good to go as is, or make any adjustments that you see as necessary. All right. All right, I'll open the floor up before we go to the upcoming events. Questions, concerns from around the coalition?
Phil, this is Brad.
Go ahead, Brad.
I just have a simple announcement. Those of you who knew who Margie Berry was at our HSHS St. Joseph's in Breeze. She has retired this month. She has a long history with HSHS, and she was one of our house charge nurses at St. Elizabeth's before taking that position, and she was incredibly passionate about that. But filling her position will be Stacy Zobrist. I do believe Stacy's in attendance. I will be sending that contact information to Lee and so forth, so we can get any kind of updates or her added to lists. And then I'll work with her on getting her into the membership planet. So.
Perfect. Well, congratulations and welcome. I can say that in two parts. So congratulations to Margie and welcome to the new folks. I really appreciate you letting us know, Brad. Thank you. Tina.
I just have a question for Greg.
Sure, go ahead.
Yes.
Hello? Oh.
Yes.
My question is, we have a piece of equipment from like 2010. We've had, as all hospitals with surge and critical staffing and that, we've had to pull a couple of our vital sign monitors out, and we have problems with them. Well, there's no parts available. Our biomed said that we need to just totally take them out of service. I mean, is there something specific, since it was a grant, that we need to do, or I need to document that somehow?
You purchased it with the grant?
Yes, back in 2019 or 2010.
Was it over $5,000?
No.
Phil, I don't think they have to do anything, do they?
No, nothing. If it's not classified as equipment, which would be the $5,000, unless your organization classifies it. That's like one of the, I guess, crazy loopholes with a lot of that. Unless your organization classifies it as equipment, and let's say it's $100, which most organizations don't. Because I think ours, I don't know, BJC's is like 2,500 or something. It's a lower number than the 5,000. But if you're following the federal guidelines, yeah, if it's less than 5,000, you don't have to.
Yeah, I would say, Tina, if you just document that somewhere and have it in your files for the grant, should you ever be audited or something like that, I think you'll be fine.
Okay, thank you.
Hey, Phil.
Lee. Go ahead. Go ahead, Lee.
Okay. The other thing I would like to bring up to everybody is we've had the ongoing conversations on both sides of the river regarding the whole Ebola threat and all of this. There's been a renewed push to evaluate what our regional Ebola preparedness is. Be looking for a survey to come out from Member Planet sometime in by the end of the year, with the next couple of weeks, just asking for baseline on what your facility's status is. We are looking at potentially purchasing a cache of supplies specific to those highly infectious, contagious, bad juju diseases, and storing that within the region at the regional warehousing. But before I make a large bulk purchase, I want to have a good understanding of what we actually have inherently in the organizations around the region. So please be watching for that. It'll come from either myself or Scott Klosterman, and we'll follow up. And if you do have any questions, please do let us know. The other thing was I had several emails from folks regarding an email that went out from Scott through Member Planet with links to dates for what we call staff assisted visits. Phil, do you want to clarify what that was regarding? Because I know there's been a lot of questions come to me about it directly.
Sure. Yeah. So those opportunities there, again, are, I think we talked about it maybe 2 months ago now, but those opportunities are for you to sit down with Scott and to discuss preparedness related stuff, from whether it's internal preparedness or a regional perspective, and to provide us feedback on where you need support in specific areas. And obviously we could take back any best practices and share with the coalition, but to provide you the support to see exactly what you need from the coalition, as well as also do a cursory review of your decon area and standard practices and procedures with regard to that, because Scott is one of our decon instructors and he's our decon team chief here. So we'd like to, again, provide both that as kind of a service to you, and to give us better insight on what's needed, because we don't do the old, I think we talked about last month, Tina said, like the old visits when Greg used to come out and myself, we come out, because we don't do that specifically anymore as a, I don't call it a rite of passage, but as a requirement, because that's what it was. It was a requirement that we were fulfilling. We want to make sure that we're just, again, staying connected with you guys. We're probably going to have a pre kind of screening checklist to go out. And I know he's brought, for those who, I think Boyd and a few others, maybe even Tina, has already signed up. But it'll probably be a kind of a pre-questionnaire for you to fill out, and then maybe a post one. So we're still working out some of the details, but that is super low threat, just trying to get some feedback and help in any way we can to support you guys. So.
Hey, Phil, this is Dale at Sparta. I have a quick question for you.
Sure.
Hey, we've been, our team's been working on updating our disaster management plan, and in that we're moving the location for our incident command center. And with that, we had to reroute the antenna for our ham radio, which brought up the question, when was the last time the ham radio was tested? And nobody can answer. We don't really know. So it has to have been over a year. And we used to have somebody come out once a year and do that. Do you know who does that now, or if they're still doing that or not?
Well, I'm going to turn that one over to Lee. I know the answer, but go ahead, Lee. I know he knows it way more than I do.
Yeah, Dale, typically it was done by the local amateur radio club. They had somebody that was a volunteer basically to come in and facilitate those communications. Let me reach out to the folks here in St. Clair County and see if they can tell me who it would be down your direction. Because I'm really not sure. I know I live in Madison County, so I know the folks up here. I know some of the folks in St. Clair County. Unfortunately, amateur radio is predominantly an older population. I can say that because I am one. But we've unfortunately lost a lot of those guys that had been doing that old age, COVID, you pick it. So I'm sure there's some changes. Let me try to track that down. But what I would encourage, if you have somebody in your hospital who is a ham radio operator that's licensed, anybody can go in, tune up a local repeater, try to put a radio call out and see if anyone answers them. And that'll at least tell you that the radio is working. We do need to kind of revise that the amateur side of our contingency planning for comms and make sure that we have a better solution there. So more to come on that. I'll reach out this next week when I'm back in the office.
Okay, I appreciate that. And as to my knowledge, we do not have anybody here that is licensed to work a ham radio. So yeah, I'll be looking forward to your response. Thank you.
Yep. Well, that brings another point up. I know Phil and I talked about stuff like this in the past. Something that might be worth doing within your HSOs and your organizations in general is reaching out and doing a survey of your staff. A lot of times, there may be some folks that do things like ham radio as a hobby that, it's just not known. If there's a way you can survey staff members, and this goes for everybody, because relying on the radio clubs may not always be an option. But if you've got members of your staff that can, or legally can, meaning have a call sign and all that, that does give you a fail safe to your fail safe, as it were.
Great, thanks. We did have a question in the chat. Greg, if or Beth, do you guys have the address offhand that we can put in the chat for the Fairview Heights office? Greg, if you're speaking, you're muted.
I don't know it off the top of my head, but I'll check out, I'll put you down and look for it and then come back up and put it in.
Hey, Phil, do you know the suite number for ours? Isn't it next door?
I don't know off the top of my head yet, but we ain't took the keys yet, so I haven't committed to memory. All right. Any other questions, concerns from around the coalition?
Were you going to talk about the POGs?
Are you talking about the oxygen trailer?
Yep.
Okay, well, I'm talking about upcoming events.
You have it on there. Got it.
Oh, there we go. I see the addresses in the chat. Thanks, Deb. Appreciate it. Next coalition meeting is January 4th. We do have Decon Train the Trainer going on starting tomorrow. So I think we talked about it last month, but we're doing a I'm not gonna call it a test run. We did a test run when we did our Train the Trainer course. This is something that we're gonna just push hard forward. We're doing it with our team here with BJC. They're all BJC HSOs and instructors, people I think we got a total of 6 signed up. Hopefully we get all 6 tomorrow, that are highly motivated, truly dedicated, like it, love it, want more of it, decon, and they want to, we're going to try to make sure that we got a trainer core that we can leverage on both sides of the river. So these folks will not be just limited to teaching BJC facilities as well. They will come over here and teach with us as well. So this will be a good thing. Hopefully we'll be able to grow and foster more instructors. The oxygen generator course is next week or week after next week. It's 2 days down at French Village Fire Department here. I know Eric's been working this, and Lee. Is there anything else that you want to talk about on this one, Lee?
So for those that don't know what we're talking about, we do have a portable oxygen generating system that was purchased on the grant several years ago that we've really never actually set up and used, partly because we don't really know how. So we do have the vendor that's actually coming in to do some routine maintenance on it and teach a core group of folks how to set this up. The idea being, if we have to set up the field hospital, that we don't have to hope and pray that we can get oxygen cylinders from enough hospitals to make it work. We can actually set it up and fill oxygen cylinders and or hook it up and actually push straight out to patients. We would like to get a few folks. We will have some folks from Reamer that are going through it, but we would like to actually have some folks from the HSOs, especially the ones who think, oh, I might request this, to come out so that there's more than just one single point of failure. We have multiple people. So if you're interested, the link is in the member planet, and we would welcome that participation.
Got it. Thanks, Lee. And Molly, I see you there. Gotcha, Molly. Okay. We have a lot of CISM and crisis management training coming up. I know, Mike, I don't know if you're still on. I think the January one was close to full. I know we had like 20 on the books. Do you know off the top of your head, Mike, if you're on? No, say Mike had to drop off. But those classes are filling up. So they're out there, Member Planet, please jump on. This was something that we talked about 6 months ago, 8 months ago, about, and this is focusing on responder safety and health. This is not direct patient. This is not for the patient. This is for the provider. So please, if you want to be able to get involved, jump on it now. And some of this, we did focus on the pediatric side as well. That will be outward facing. Okay. All of these courses, great. You can hit one of those links and sign up. We need to expand that capability as much as possible here on this side of the river. The project deadline for 2024 is rapidly approaching. I know I had to send out a few links to folks this past month. What I will say is this, is that while we do this on the 31st of each year, I always get, January 20th, somebody says, hey, is that link still up? And I'm trying to squeeze folks in to get their projects in. As of right now, there are only 2 project requests that have been submitted by the coalition. This year, I can't extend that timeline. And the reason being is because what's going to start happening as well, in talking with IDPH, is that they're moving their timeline up even further, because they want their goal, as is our goal, is to be able to have money, everything submitted and money flowing within the first 3 months of the fiscal year. If not July 1, July 30th, or somewhere around there. They want that to be as close to the beginning of the fiscal year as possible. So what that means is we have to move our deadlines up. So we got to keep moving that stuff further and further to the left. We can't continue to extend it. So this may be the last year that we're doing a 31 December, and more than likely we'll probably be moving it up to a 1 December timeframe, because that gives us clear insight on who wants to submit a project, and to start the paperwork as early as possible. Okay, because just the paperwork process is just very time consuming. So the Mercy deadline, or excuse me, Mercy exercise, looking at March 1st. That's going to be our coalition meeting day. So folks should already have it on the calendar at 10 a.m. Please sign up to register. We'd like to make this a very successful exercise for everyone. So please get yourself registered, and we will see you in March. And IDPH Summit is going to happen. I forgot. I think y'all gave me the dates last time. Beth or Greg, did we have the dates for the summit this year? No Beth, no Greg. Okay. All right. But it's going to be in June. So that will occur. Barring any other questions, checking the chat really quick. Hello, can VA come to some of these training events? Are you talking about the CISM training events?
Yeah,
George,
George Ferrani, St. Louis VA healthcare system here. I'm the emergency management specialist currently here, and I also have an area emergency manager, Derek McDonald. And we love to be flies on the wall, see what our surrounding coalition partners are doing for training and how they conduct it. As the FCC coordinator and the PRC coordinator, which is the Federal Coordinating Center and the Patient Reception Center during disasters and emergencies, we're your representatives, and we'd like to really kind of get to, if you will, see what you guys do and how you guys do it, so we have a capability understanding.
By all means, we would. I'm sure we could actually you could definitely audit some of those, and when we do have vacancies, you can definitely fill in some of those. I would say that we would, in some cases, we do have a require, like if you're going to fully attend it, we expect something. I hate to say it, we expect something out of you. Like some folks, we expect to expand our critical incident stress management team with some of the courses we do. And that might not be these specifically, but you're more than welcome to be a part, just let us know that you'd be in attendance. When you do sign up, we can see you on there. So, if we need to, we will reach out. I encourage you to, if you have not, make sure that you are signed up on Member Planet. And
We are. Yep.
Okay, and I'm about to say,
Or I am, I should say.
Yeah, I was
And
saying.
thank you, Lee, for inviting us in.
Yeah, I would say I knew the names showing up in the emails. So, by all means, yeah, we don't do, we don't put on a lot of these trainings and make it really closed door, unless it's for a very specific purpose, kind of like the austere training class that Mike discussed
Yeah,
earlier.
no, absolutely. And thank you for the feedback. It's, as a federal asset, I would look at the decon, for example. There's not a, the crisis group. We can probably assist if we needed to with our crisis management team, things like that. But that's future events, of course, but just something to consider.
Indeed. Much appreciated. And lastly, I see Beth Bibb put in there June 6th and 7th and 8th for the IDPH Summit. 3 days? What? That's a lot. 3 days for the summit, and it'll be somewhere in Bloomington/Normal, I'm pretty sure. Again, I just know they were still up in the air on the actual physical location. I know we've done it at the college in previous years there. Maybe it will still be there. Maybe it will be at one of the hotels. So, all right, we're going to close it out here. It's
Hey,
11.
Phil.
Oh, go ahead, Beth. Yes.
This is Beth. I apologize if everyone else got this, but I got an email a little while ago about EM resource latency. From Juarve, it says we are monitoring reported latency in EM resource that may impact some users. Our team is working diligently to resolve this as quickly as possible.
All right. Thank you. All right. We're going to close it out here, and we'll upload this to our YouTube page probably around 2:30, 3 o'clock today. So you guys take care. Have a great holiday. Merry Christmas.